main function of pancreas is secretion of insulin to control, and the pain will be so severe that sometimes patient may have to sit and force and bend themselves, and the patient has got vomiting, sometimes even fever. So they should immediately Hi, this is Dr. Srivatsan, surgical gastroenterologist. Today we shall see about acute pancreatitis. Now, what is pancreas? Pancreas is a long leaf-shaped organ which is situated just behind the stomach in the upper abdomen. So what happens when you have an acute attack of pancreatitis? See, the main function of pancreas is secretion of insulin to control the blood sugar and secretion of certain digestive enzymes to digest the fat, that is what we take in the food. So these are the two basic functions of the pancreas, which is called as the exocrine and the endocrine function. So what exactly happens when you have an acute attack of pancreatitis? Who has got an acute attack of pancreatitis? What are the risk factors involved in it? And what to do when you have such an attack is what we will be speaking about in this. So acute attack of pancreatitis வரும்போது patient வந்து ஒரு severe upper abdominal pain இருக்கும், which will radiate to the back, and the pain will be so severe that sometimes patient may have to sit and force and bend themselves towards the front so that the pain is relieved. So that is the intensity of the pain when the patient has got an acute attack of pancreatitis. Now, who has got a high risk of developing this? The first risk factor for developing an acute pancreatitis is alcohol consumption. So those who take alcohol have got a very high risk of having an attack of pancreatitis. Number 2, gallbladder stones or bile duct stones. Stones that are there in the gallbladder or in the bile duct can slip through the bile duct into the pancreas and can produce an acute attack of pancreatitis. There are several other causes like high levels of triglycerides, high levels of calcium, certain abnormalities in the pancreatic duct called as pancreatic divisum. These can also produce acute pancreatitis. So, if acute pancreatitis irukku, so what one needs to do immediately? So, whenever the patient has got an acute upper abdominal pain, male wide very severe upper abdominal pain radiating to the back, and the patient has got vomiting, sometimes even fever, so they should immediately consult a doctor nearby and they should do a blood test and an ultrasound. These two basic tests can rule out an acute attack of pancreatitis more often than not. அப்படியே acute attack வருது சார், next என்ன பண்ணணும் அப்படின்னு பார்த்தோம்னா, acute attack of pancreatitis is subdivided into 3 types: mild, moderate and severe. Mild pancreatitis more often than not can settle down with just IV fluids, medicines, antibiotics without any interventions. Whereas the moderate and the severe attacks of pancreatitis can involve the lungs, and the patient can have difficulty in breathing, which might require them to be admitted in the ICU, sometimes even in a ventilator. So, what do you need to know about this? Always strive to ensure that your pancreas are healthy. So, what can you do to ensure that the pancreas is healthy? Eat a balanced diet with lots of fruits and vegetables, less of fat. Try to avoid alcohol consumption. Alcohol is a risk factor for pancreas. Try to avoid alcohol consumption. Smoking again is a risk factor for chronic pancreatitis and pancreatic cancer. Try to avoid smoking. Avoid stress, anxiety, have a good sleep, and most importantly, have a balanced weight. These are the most important factors you need to keep in mind in order to have a healthy pancreas. Stay safe, stay healthy, and most importantly, stay aware.